Hi, I am Dr. Shishir Shetty. I am a professor of surgical oncology and I head the GI Thoracic Hepatobiliary Unit of Apollo Cancer Center, Navi, Mumbai. Today I am going to talk on colorectal cancers, which is one of the most common cancers that I am seeing nowadays. And unfortunately, it is increasing in a very endemic fashion. The number of patients having colon cancers are day and by day they're becoming, I'm seeing a lot of them in a younger population. So what used to be the disease of the 60s and the 70s and the 80s, now I'm seeing patients of 30-year-old, 40-year-old, 50-year-old having colorectal cancers. Very unfortunate indeed. So I would advise that any patient, any person who has got a change in his bowel habits, change in his bowel habits, if there is constipation, obstipation, diarrhea, which is not getting treated, they should get themselves checked up. One of the most important things that should be done is an ultrasound of the abdomen, a colonoscopy, and a simple test. Even if you are not doing the simple stool test to see whether there is blood in the stools, is good enough for us to detect colon cancer, whether it is in the rectum, whether it is in the descending colon, transverse, or the ascending colon. This is one of the most common sites. And today, many of them, especially after the COVID epidemic, we are actually seeing a lot of people who are untreated, and most of them we are seeing as emergency. The youngest patient that I've operated was 19-year-old. And very unfortunate that he got it. We don't even know why he got it. But today, unfortunately, due to bad diet and lifestyle, this chances of getting colorectal cancers are increasing. The longer you have constipation, the more the problem is. And it may be because of a lurking cancer. Every bleeding piles is not piles. Every bleeding per rectum is not piles. So there is a possibility that you may be hiding some sort of a cancer inside. Today, we have state-of-the-art technology to take care of colorectal cancers, whether it is, say, robotic or laparoscopic or minimal invasive surgery. We go ahead and save the sphincter in most of the cases. In fact, of all the cases where a permanent bag used to be done a decade ago, today in those cases also 30 to 40% of the cases we are trying to preserve the sphincter, and a patient can live a bag-free life. Our aim of treatment is first cure. Cure is the aim of the treatment, and followed by a healthy lifestyle. So both the things, taking care of the disease where we aim at cure, and lifestyle changes which are important in treating these type of cancers. We at Apollo Cancer, we have a team which takes care of all this, whether it is radiation, chemotherapy, immunotherapy, or surgery. I think that the best way to manage today is have a joint discussion to decide which patient needs surgery, some patient may need chemotherapy or a combination. So we hold tumor boards which take care of this. As far as colorectal cancers are concerned, these are curable conditions, and the early detection is the key. You have a problem with constipation, you have unexplained weight loss, you have bloating, you have something called as anemia, where in males especially, if you have anemia after the age of 40, there is no reason why you should get yourself checked to rule out cancer or any bleeding problems. So as we get older, it is important that each complaint, especially abdominal complaints, whether it is a bleeding pile or whether it is constipation or there is bloating, should be taken seriously. We should think of getting ourselves checked, because if we detect cancers early, then we can go for cure. The most important, the word is cure. Cure is the only way that we go. So colorectal cancer cure is by early detection, good treatment, and having a healthy lifestyle. If possible, adopt a healthy lifestyle, exercise regularly, eat more veggies, fruits, and fiber in your diet. Avoid constipation. You may never get a colon cancers. Thank you so much.